like to welcome everybody, and what I'm going to discuss today is about the family of Zyppah appliances. And in particular, the Zyppah V, which is along with the other Zyppah hybrid appliances, are the world's most exciting appliance, and you've never heard of them until now. I believe that you're going to hear today why this is probably the most valuable tool in terms of appliances for your patients, and how it's going to be able to integrate with your existing practice. So let's move right into here. What's key about the Zyppah family of appliances is they are dual action hybrid appliances. Now what I mean by that is they're the first and only appliances to be both a mandibular advancement device to bring the jaw forward, as well as a tongue retaining device to grab on the tongue. And in particular, the tongue retaining devices in the past have always been uncomfortable, difficult to wear, and we'll go through that. This is the first time a tongue retaining device has been comfortable. The mandibular advancement devices you're very familiar with, and this also you'll find is one of the most comfortable mandibular advancement devices yet to be on the market. When we look at these, here's the Zyppah V. Like to call it the new gold standard for snoring and OSA appliances. You can see features here. We have a couple of hooks. You'll see them attached later as we go forward. You see in particular in the back that green strap. That green strap is to go directly and address the tongue as a tongue retaining device. The Zyppah A is the most incredible appliance, as I call it here, for treating difficult cases. With this appliance, the Zyppah A, as I say, you will have success where success just was not possible before. We in our offices treat severe patients, and I'm talking about patients with AHIs over 80, oxygen desaturation, naders, minimums, down in the 50-60% level. And when we're finished with these patients, their AHIs are down below 10, many cases below 5. Their oxygen desaturation minimums are now above 90%. And that's huge because up until the ability with the A, where we're able to take that elastic and go back down behind the tongue, posterior and behind the tongue, you just could not get success with these very, very severe cases. And now with an appliance for the first time you can. We have before and post-sleep studies with dozens and dozens of patients that we are treating every single day in our office. And it's just really opening up the ability with treatment for patients that are CPAP non-compliant and yet still are severe. We have the Zyppah Pro appliance. Now we call this the Zyppah Temporary. It is a boil and bite appliance. It's titratable, and it also has the tongue strap. The tongue strap, obviously, again, is for as a tongue retaining device, so it does both actions. We use this appliance for patients where maybe they don't have the finances to go with a custom appliance. Maybe they lost their job, they have an HMO insurance, and we don't want to just kick them to the street and say we can't help you. We can help them this way very inexpensively with a tongue retaining device for a few $100s, and as soon as they get a new job, better insurance, they're going to come back to you, and now you can do a custom appliance for them. We call this the Temporary. We also have the Zyppah Dorsal. For those of you that still like the dorsal style, the Somnodent type style, we've added the elastic to the posterior so you can still have a hybrid appliance and still get the best of both worlds. Here we have the Zyppah Herbst, where again, if you like the Herbst type of appliance, you can use the posterior elastic here and still get that hybrid technology. I mean, I just love hybrids, whether it's a Prius that uses an electric engine and a gas engine, or it's a dental mouthpiece that allows you to have both a tongue retaining device and a mandibular advancement device all in one. Now let's talk about the Zyppah V for a second. Why is it the most comfortable MAD in the market? Good question, so let's get to it. Number one, it's lightweight. Here you can see it's a vacuum formed plastic, so not very different than a bleaching tray. Lightweight in the mouth is wonderful. The difficulty with small, lightweight appliances in the past is durability. We went big on acrylic to make it more durable. We've solved that problem, and you'll see by the elastics we use to do the advancement, and they take all the force, all the abuse. It's also small in size. Being small in size, we also have a small increase in the vertical dimension. As I'm going to talk later, by being small in size and small increase in the vertical dimension, we can get primary lip closure. As you're going to find in your world of treating sleep medicine, the smaller the appliance, the smaller increase in vertical dimension, getting primary lip closure is going to be key. I want to create nose breathers with all our patients. Mouth breathers creates many problems with it, aside from dry mouth, ropey saliva. By creating nose breathers, you're going to be way ahead of the game. Also, the Zyppah V will minimize TMD issues. The reason for that is we're not locking the jaw in place. We're allowing freedom of movement in all three planes. Front, back, side to side, up and down. Patients can easily talk with it. They can even drink water with it. Now here you can see the appliance. It has the elastics on there. We've actually even made some changes with this. We now use hooks on the top and the front left and front right appliances. But the key is the side elastics. The side elastics allow for complete freedom, as I said, in all three planes. Now, in addition to that, the way we advance the jaw is we increase the tension on the elastics. So they're orthodontic elastics. We'll start with 6 ounce, go up to 8 ounce, 12 ounce, and then 16 ounces as we bring that jaw forward and we duplicate the mandibular advancement features of all common mandibular advancement appliances. The other key factor here, and this is very, very important, is on the lower appliance there are these posterior blocks. They're flat plane blocks. What those blocks do is they eliminate all occlusal interferences. So you no longer have any centric interferences, you don't have any lateral interferences. When you eliminate interferences, guess what? You eliminate most of your TMD issues, you free up the musculature, and you get something that is very, very comfortable with none of the negative consequences of typically bringing that jaw forward. Now, we look at this as one of the easiest appliances to treat with. Well, what do I mean by that? Well, let's look at it. First of all, you just take upper and lower impressions. Alginate is a fine material for doing this, whichever your preference is, but just take those upper and lower impressions. No bite registration is required. Now, I don't know about most of you. When you take a centric bite and you have tooth contact, that's very easy to get a good bite registration. The minute you open the teeth, the minute you open that space there, and you try to get that accurate in terms of where the upper and the lower jaw line up, it is very, very difficult. I can tell you, I'll have the dental lab that'll call me up and they'd say, you know, Dr. Greenberg, do you really want us to go forward with this? And I'll say, well, send me pictures. And they'd send me pictures because I'm thinking, oh, my assistants, they messed up. They just really did a lousy job. And they'll send it to me and I'll go, wow, that was the one that I took. And it is so darn off. It doesn't matter if you're a dentist or an assistant. Taking a bite registration when you have no teeth to go against to keep that from shifting left, right, forward, back is a very, very difficult task. With the Zyppah V, you do not take a bite registration. It becomes irrelevant. The next thing, no need for a George gauge. We don't need to approximate and try to figure out numbers and have your staff do a bunch of math to figure out how far you want to advance that jaw. With the Zyppah V, it's just not necessary. It's a nice step that's eliminated. This can also be used on fully edentulous patients. Now, isn't that a nice surprise? You've probably been told all along you cannot use appliances. Oral appliance will not work on edentulous patients. Well, as we go through this, I'll show you how we can exactly use this on edentulous patients. And one of the keys is, of course, the elastic for the posterior elastic for the tongue that now acts as a tongue retaining device here. Easy and fast delivery appointment. This can be done very, very quickly. It's a very easy delivery appointment. In addition, there's no heavy and clanky metal parts. Okay, we're all used to some of those appliances. I don't need to name names, but when you give it to the patient and they see all this metal there, and they kind of, I think in James Bond, you had Jaws, not the most romantic and not the most attractive type of appliance. There are no screws or screwdrivers, so parts-wise, you're easy there. We use common orthoelastics to create the advancement. Okay, they're around, they've been around forever, proven, tested. Easily modified for teeth that are short with minimal retention. Some appliances don't work well on short teeth with minimal retention. This will work great. You can easily tighten the fit with thermacryl. So unlike a lot of your appliances that you might make in your office, if for some reason it comes back, it's too loose, or say a patient just had a new bridge made, you can typically get that to fit using the thermacryl type of material. Works really well in these. And the appliance is incredibly durable. These will last, the longevity in these is wonderful because they don't take the stress of grinding back and forth. Oh, here's one that's probably appealing to most dentists. It's one of the most low-cost appliances you're going to find at $299. Not only does it do more than every other mandibular advancement device that's out there, it's also cheaper than almost all of them. So we all know how we like to have low-cost appliances. And the tongue retaining importance. I've talked about it already. It's hugely important. It cannot be emphasized enough. But until the Zyppah appliance, nobody invented a way to do it and particularly be comfortable and combine it with a mandibular advancement device. Here's a picture from Respironics that talks about how the CPAP machine works. Now you can see on the left, the tongue falls back. It's the obstruction or the blockage in obstructive sleep apnea. On the right, you've got the CPAP machine blowing air there. CPAP, as we all know, stands for continuous positive airway pressure. Well, you still have a lot of physicians that say the tongue has nothing to do with it. Well, I don't know. I might not be the brightest person around, but I've read tens of thousands of sleep tests. In almost every single sleep test, it's more significant. The apneic events are more significant when the patient's on their back. Well, when you look at the anatomy, there's no reason it would be worse when a patient's on their back, except if it's on the tongue. I can also tell you that from clinical experience from treating thousands of patients, if we bring that tongue forward, if I grab a clothespin or a fishing hook, grab the tongue, bring it forward, they somehow don't have any more apneic events. Well, so it might be the tongue, it might not. I'll leave that for everybody else to fight about. But I know when we use the appliance, we bring that tongue forward, we get success. Here are the two most common tongue retaining devices. You've got the Avio on your left-hand side there. And the Avio, I've tried it on about 50 different patients. And unfortunately, I couldn't get a single patient to want to do it and want to use it long term. The full breath appliance is the other tongue retaining device that is out there. And the full breath appliance, the concept is real good. The way they can treat the severe patients is by bringing that little kind of tail, they bring it backwards and down. The difficulty that's always been with the full breath is comfort. Very difficult because of the gag reflex and making it comfortable. But if you can get a patient comfortable, you can have very good success with it. The Zyppah V, you get comfort, you get minimal gag issues, and it trains the tongue to stay up and forward. One of the nice things that I like about this is I'll have patients wearing the Zyppah appliance for 6 months, 12 months, and then I'll get a call. They'll say, you know, Doc, I just went away on vacation for the weekend with my wife. We went to a bed and breakfast, and I forgot the appliance, and I thought she was going to kill me because my snoring was normally so loud. She was going to make me sleep at another hotel because I'd wake everybody up at the bed and breakfast. And fortunately enough, she said, I didn't snore at all, and I didn't stop breathing, and I felt as good as when I'm wearing the appliance. Well, something that was really interesting is when I thought about it, I said, realize what happened. Muscle memory. The tongue's a muscle, so why can't we create muscle memory? So after they've been wearing the tongue for the Zyppah V for 6 or 12 months, they actually, if they missed a night or two, they still did pretty darn well with it. Now, With that said, if you stop wearing the appliance, just a matter of time before that muscle memory will go away, that tongue's going to fall back again, and you're going to start from scratch. But it's just nice to know that we do train the tongue to stay up and forward. I think research is actually going to show that long term, we're actually creating a bigger airway during the day while patients are awake. And that's your fuel line. And you've seen advertisements for appliances for professional athletes, football players, that help their performance. I think part of what's happening is when they're wearing those mouthpieces, it brings the jaw down and forward a little bit, opens the airway a little bit more. We're actually accomplishing the same thing. I have certain of my patients that are still competitive athletes, and they tell me after using the appliance or even training with the appliance, their performance is better, even lifting weights and doing other things. So that training of the tongue to stay up and forward is very significant. The elastic was a game changer. And the reason it was a game changer is because it allowed the tongue to stretch it, go back without gagging it, and then it would bring it back forward. And so we finally got a tongue retaining device that was comfortable. Now, Space Maintainers Lab, SML, which is a fantastic lab, they are the exclusive lab for all the Zyppah hybrid appliances. You can reach Scott Weiss. He heads it up. They're great over there. The Zyppah appliances are available only to the sleep certified members, but by taking this course, you are in fact becoming a sleep certified member. So you certainly will be able to use the Zyppah appliances. You'll go through SML, and you can see here they've got the information, the phone number, and they can get you all the supplies you need to get going with it. And as I said before, they're just a wonderful group to work with. They've worked with me on the development here, and they can answer your questions, and they can certainly, we can get everything you need for you.